My name is Dr. Emily Spence. I'm the Associate Dean of Community Engagement and Health Equity for the UNT Health Science Center School of Public Health. I'm also the Community Engagement Lead for the Texas Center for Health Disparities, which is a National Institute of Health specialized center of excellence. I'm going to talk to you today about some of the great work that our community partners are doing to address the public health needs that have arisen because of the COVID-19 virus. The nature of our work is changing day by day as our community addresses the public health threat of the COVID-19 virus. We'd like to take this opportunity to highlight some of the great work that's being done by our community partners to respond to urgent community needs. We know that human connection is important right now, so for this blog post, we are using a video format. Today, I'll be talking about groups who have become especially vulnerable because of the COVID-19 stay-at-home orders. I'd like to clarify that I'm not an infectious disease specialist, and this blog is not about protecting yourself from COVID-19. If you're looking for up-to-date information on COVID-19 in your community, we recommend that you look to your local health department. There are so many aspects of our lives that affect our health. As our community responds to this immediate public health threat, we are concerned about an array of struggles that may emerge during periods of social distancing and shelter in place. When you consider the factors that influence health, the type of work that we do, our social support systems, our parenting and family status, our age, where we live, and our current health and mental health status, all of these are playing important roles in our capacity to be resilient in the midst of hardship. We aren't just worried about exposure to the virus today, we're worried about what the long-term effects may be for families in crisis. Nobody has it easy right now. We are asking so much of our healthcare providers, grocery store and delivery employees, and so many other essential service providers. And for every worker who is at risk and overextended because of COVID-19, there are others who no longer have any source of income. Many people are living day by day, and each person's challenges are unique to their circumstances. In this blog, we want to feature groups who may be particularly vulnerable right now. In 2018, 59% of workers in the United States were paid on an hourly basis rather than being self-employed or salaried. And among hourly wage earners, 1/4 of them were employed part-time. Since part-time workers are more than twice as likely to be earning a minimum wage than other hourly workers, you can see how during a major shutdown, this leads to a cascade of vulnerabilities. The people who have the fewest resources and assets are the most likely to find themselves in a position where they can't afford rent, groceries, and other basic needs. They don't have the economic capacity to stock up on toilet paper or pantry items and wait out an undetermined period of low or no earnings. Prior to this community crisis, we knew that every 5th or 6th household was experiencing some kind of economic strain, such as food insecurity or housing instability. When you add in mass job loss, this proportion can grow dramatically and grossly overburden the organizations working to address basic needs in our community. People over the age of 65 are particularly vulnerable to severe illness or death if they are infected with the COVID-19 virus. To stay safe, many older adults are avoiding stores and foregoing visits with their families. The consequences of social isolation, however, pose substantial risks to human health and well-being. With fewer people checking in, medication regimens may go off course, meals may be skipped, and accidents can occur without notice. Under ordinary circumstances, rates of family violence are already too high, with 1 in every 5 to 6 adult Texans reporting current violence in their relationships. During times of family hardship, stress, and strain, we expect to see increases in the frequency and intensity of violence towards children and intimate partners. We're especially concerned right now during stay at home orders because social isolation is a key strategy used to prevent family members from getting the help they need. Our community partners at organizations like Cook Children's, Alliance for Children, One Safe Place, and Safe Haven are working so hard to respond to increased needs for safety, shelter, and support. We're talking with some of our community partners today to learn more about how groups and organizations are responding to these emergent needs. We encourage you to find out more about some of our community partners by following these links. And we appreciate our sponsors today, the National Institutes of Minority Health and Health Disparities, the United States Department of Health and Human Services Office on Women's Health, and the State of Texas Office of the Governor.